Good evening, everybody. I'm Sayukta from Beautiful Spotless Skin Team, and I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans right from the beginning of civilization. Few of the very common conditions affecting the look and feel of a person as acne, hyper or hypopigmentation, and even hair loss. Out of these, acne is a big concern. Acne is a very common skin condition that can impact anyone. Whether you are a teenager or an adult, this skin complaint is no stranger. Knowing the various types of acne can actually help you to treat the condition better. Acne vulgaris is a chronic condition affecting more than 85% of adolescents and young adults. It is one of the most common diseases affecting humanity and quality of life. It goes beyond just being a skin ailment to various psychological disorders such as depression, anxiety, stress, low self confidence. Hence, it is important to know about the holistic treatment approach for this ailment. Despite its prevalence, few people know that June is Acne Awareness Month. Acne Awareness Month was launched to combat the negative stigma surrounding this very common skin condition and also to be aware of treatment approach for acne management. So let's connect today with our skin expert, Dr. Kirti Jodhani, live from Guwahati, to talk about skincare and acne management. Dr. Kirti is consultant dermatologist and skin hair specialist. She is the most promising and young dermatologist of Guwahati. She pursued her MBBS from Medical College and Hospital, Dibrugarh, Assam, and MD from Guwahati Medical College and Hospital, Assam. She got featured in Femina Miss India magazine Feb 2023, currently consultant dermat at Orthoderm Clinic, situated at Bhangagarh, Guwahati. Her aim is to provide clearer, glowing, and healthier skin and hair care and to provide holistic approach to all skin problems. It's such a pleasure to have you with us, Dr. Kirti. Very warm welcome to you.
Thank you for having me here.
So, doctor, today we are going to talk about acne management and the importance of skincare routine. But before that, we would like you to tell us what is acne? What are the various different types of acne lesions?
Acne, basically, as we all of us know, is a pimple which we have commonly on our skin. So the different kinds of pimples or acne which is found are first precursor lesion. The starting lesion is always a comedone. Comedone can be a whitehead or a blackhead, which we commonly refer to as. Then the second stage, it goes to a papule formation. Papule is basically the red colored bumps which we see mostly over the back, face, chin, forehead. And the third form is the pustule. Pustule means when there is a pus formed over the lesion, that white color pus-filled lesions which are painful on touching and normally also at rest, it's painful. So that is the pustule. And the last form is the nodules. Nodules are extremely painful, large lesions, mostly seen in the adolescent male population. These are also seen sometimes over the back of the individuals. So acne, it's basically a lifestyle disorder. Before, it was believed that only teenagers could have acne, but now it is commonly seen in adults also. Mostly because of the sedentary lifestyle, the eating habits, the sleeping habits, it has become very, very common to see every individual having pimples in some point of their lifetime. So we are supposed to take care of all of it, and we'll be discussing this, I'm sure, as the session goes.
Definitely, doctor. Doctor, many a times we see acne around our jawline. Many a times the pattern or placement of acne is different. Does specific areas of face acne mean specific cause?
Yes, definitely. So as you correctly said, jawline acne, mostly if seen above 25 years of age, mostly in females, then it points to a disorder called PCOS. Such individuals should always be asked about their menstrual history, if they're having regular menses, if the flow they are having is normal as compared to before or has it decreased, if the number of days they're having the menstrual flow has decreased. So all of that history has to be taken. And if anything points towards an abnormality, then an ultrasound scan is to be done, especially including the ovaries as well. And if the acne is seen over the forehead, then we are supposed to rule out dandruff. People with dandruff tend to have acne on their forehead. Also, people who apply oil in excess amounts, they also tend to have acne on their forehead. So these things also need to be looked out carefully when we are seeing a patient, and proper history and detailed examination is always required in an acne patient.
Right. So it's just not about the appearance. It could also be that some underlying medical condition is there. So it's important to
Yes,
go and consult the right person, which is a qualified dermatologist.
yes,
Now, doctor, what are the different treatment options available for acne?
yes. So to start with, we have medicines to apply. Like if you just have one or two pimples, we generally give you to apply. So the most commonly prescribed medicine, which all of us now know, is clindamycin. So clindamycin, if an individual has been applying for a long time, it's basically an antibacterial to which an individual might get resistant to. So then we have other options like we have clindamycin and benzoyl peroxide combinations. Then we have retinoids, that is adapalene. But adapalene, it's generally said that you should always apply it under the supervision of a dermatologist after being advised by a dermatologist because it can sometimes cause irritation after application, which could lead to more side effects. So it's always better to apply it after a dermatologist has advised you to apply it. If retinoids are applied, they are very helpful if applied over the blackheads. The comedonal acne, that is the precursor acne, as I said, it's very useful for that combinations. Then we also have basic moisturizers, sunscreens, and face washes, which also should be customized according to the skin of the individual. Very mild acne, oily skin, salicylic acid based face washes are good to apply. Then we also give oral medications if the acne is severe. So we give antibacterials like doxycycline, minocycline, and if the acne is very severe and not responding to antibacterials, then we give isotretinoin. Also, as I said, always the underlying conditions, if there is any doubt in the history, then the underlying condition should always be ruled out. Then some in-clinic treatments are available for acne. Like we could go for simple chemical peels, which contain maybe salicylic acid, azelaic acid. Then some people have acne with pigmentation. For them, we could also go for carbon laser peels. Then some people have scarring after acne, those depressed scars. They usually need in-clinic treatments. They do not go away with medicines or creams alone. So the laser treatments, the MNRF treatments, and PRP treatments are available, which an individual can avail for the acne scars which happen after the acne has subsided.
So various treatment options are available. What
Yes,
is required is that a person who is having acne should go and consult a dermatologist
definitely.
first. But the thing is, doctor, you'll also agree with me. What we normally do in our society, what is the more way that people normally go for is go for home remedies, some quick fixes, or go for over-the-counter medication, get some cream for the chemist, and start applying it. We would like you to shed some more light over how dangerous, these things could go or how harmful it is for our skin.
Yes, very commonly in my practice, I've seen people applying toothpaste over the acne.
Right.
This is absolutely a no. It's not indicated, it should not be done. The toothpaste might further irritate the pimple, causing a flare. So, we are never, never, never supposed to apply toothpaste over the pimple, thinking it to be a quick fix. Also, some people apply multani mitti. They do this home remedies which are of no use. If at all you want to do anything, clindamycin based gels are a safe option which can be availed at home. Other than that, any particular treatment, if you want to avail, should always consult a board certified dermatologist before applying any kind of gels or before in the intake of any kind of oral medications.
Right.
So, home
And
remedies are never a quick fix for the pimples you have.
okay, so don't go for home remedies, don't go for over the counter medication. Go to a qualified dermatologist, get the right advice, and follow them. Now, the thing is, doctor, as you just mentioned, that it is important to follow a regular skincare regime. You said that it's important to have a good face wash, customized face wash, moisturizer, sunscreen. But again, people have various things or complaints regarding them. Now, people who are acne prone or have a skin which is oily will feel that it's because my skin is dirty that I'm getting, the acne, and they'll keep on washing their face again and again every now and then with a face wash or a cleanser claiming that this will, dry up my skin and thus I won't get any acne. What's your say on that?
No, face wash ideally should be done only twice, even if your face is oily. For those with oily skin, they can opt for salicylic acid based face washes. If you continuously wash your face, you keep washing your face, then the face washes, the materials which are contained in the face washes irritate your skin, leading to further acne formation. So it is never advised to wash your face more than twice until and otherwise, if you're going out and if you feel you have had a lot of dust exposure, you want to come and wash your face, you could use a very mild cleansing lotions. Very mild cleansing lotions are also available, which just remove your dirt and your oil and they preserve the skin layer very adequately. So you're not supposed to wash your face with a lot of harsh face washes. It should be very mild. If you're wanting to wash it multiple times, the other times, the face wash should be very mild in the form of cleansing lotions. Micellar water is also available, which also you can use to wash your face. But the harsh ones, the salicylic acid based ones, you're supposed to use it only twice a day. That is the maximum you should use it.
Okay. Now, again, with moisturizer, people have their own, concepts. They'll say that already I'm secreting so much of oil. Why should I, moisturize my skin? I don't need to moisturize. Oily skin people normally have this tendency. Again, what's your say on that, doctor?
Basically, everyone should moisturize their face at least once a day. For people with oily, acne prone skin, we have moisturizers which are very light, water based moisturizers. So they can always opt for those kind of moisturizers. Very thick cream or based moisturizers are not generally recommended for people with acne. But light, water based lotions can always be used for those who have oily skin, for those who have acne. Moisturizing your skin at least once a day is an ideal thing to do.
Right. And what about sunscreen, doctor? I'm sure you also get to hear a lot of complaints or
Yes.
excuses for not using sunscreen. I get a lot of sweat after using sunscreen. I don't like the white cast. I'm already having acne. How can I, layer it up with sunscreen? Or my exposure under the sun is not that much. Why should I use sunscreen? So again, what's your say?
So if you ask me to choose one product apart from the face wash, which a person should do everything, is the sunscreen. A sunscreen should be a person's best friend. If they start applying sunscreen from the right age, they will not have a lot of issues with their skin. Obviously, it is recommended to use the proper sunscreen suited for your skin type. For people who have oily, acne-prone skin, we have gel-based sunscreens which they can use. So a person should apply sunscreen ideally half an hour before the sun exposure, and they should reapply it every 3 hours if they are outdoors. Also, adequate quantity of sunscreen application is recommended, which is 2 fingertip units. So there's no alternative to sunscreen. Even if you don't like it, you have to get used to liking it. It is not a very difficult thing to do. Once you start using it, you get used to the habit of using it. But sunscreens are a must. Whether you have acne or you don't have acne, it is a must for everyone. Whoever is watching this video, they should start using sunscreen from tomorrow itself. And it is always better to consult a dermatologist once to assess your skin type and then start using the proper sunscreen. Ideally, an SPF of 50 with a PA star of 3 plus is recommended. But individuals below 16 years of age, they can also use SPF of 30. So that is also advisable, but people should use sunscreen.
Right. And what's your opinion about the use of serum in acne or acne-prone skin, doctor?
Serums, if at all people want to use, they can use niacinamide based serums. They help in the acne and also the pigmentation which the acne leaves. Ideally, a lot of serums are not recommended. Also in the market nowadays, we get salicylic acid based serums. So that will also help, especially in people who have oily skin. They can opt for salicylic acid based serums. Again, I will always advise to just consult your dermatologist first before opting for these serums. Vitamin C serums are not recommended for people who have acne because it has been seen that these lead to more breakouts in people who have the tendency to get pimples. So vitamin C is ideally not recommended. But niacinamide and salicylic acid based serums are some options which an individual can opt if they have acne.
Now, many times people who have acne or who are prone to acne will ask that, can I use makeup? And many a times, they are into such professions where makeup is just not by choice, it's the necessity. What can they do?
Yes, this is a very difficult situation for us. So, we generally recommend liquid based foundations for those individuals, and we recommend that you either use a moisturizer and then apply makeup over it instead of directly applying it over your skin. It is to be removed as soon as possible after you reach home. Also, nowadays it is recommended that the makeup brushes you use, you should wash it with a mild shampoo before using it. It should be properly dried before using, and you should try and wash the makeup brushes every time before using it. Because if the makeup is left on for the brushes on too long, there is bacterial colonization sometimes over the brushes, which again can lead to the acne formation. So these are simple tips which you can use to avoid further acne from forming on an already formed skin because of the makeup use.
Right. And we have Suhana Thakur with us, a viewer, and her question is, should I avoid touching or picking at my acne lesions? What's the best way to care them?
Yes, this is the biggest challenge we face, that most people whenever they have pimple one, two, or maybe 10, they just tend to pop it out. They are not happy at all, and some for some individuals it becomes a habit to keep touching their acne, which should never be done. It is very dangerous, in fact, to touch your pimples which happen on the T-zone. The T-zone is this nose area and the forehead area. Should never touch your pimples on that, because if sometimes you squeeze too hard, the infection could go inside too. Also, the most common hazards of picking and pricking your acne is the pigmentation. The acne is easier to treat than the pigmentation. The pigmentation which the acne leaves is very difficult to treat. So the ideal way to care for it is to tie your hands down so that your hands do not reach the pimples. It's a very conscious effort that an individual has to take to not touch their pimples. We have to keep counseling them that you should not touch the pimple. If they can do that, half of our job is done there and then. Then only the half part is remaining where we just need to treat the pigmentation. But if they keep touching the pimple, then the job of the doctor also becomes very difficult to treat that pigmentation. So it is a very proper counseling which we as doctors do so that they do not touch, they do not pop, and they do not prick their pimples. Some
Right.
people over exfoliate, over scrub their faces. That also leads to the pigmentation. That is why it is always said that you should use your products under the supervision of a dermatologist in case of facing from severe acne issues.
Right. And we have John Burgess with us. His question is, are there any specific sunscreen recommendations for individuals with acne prone skin?
So gel-based sunscreens are good to do, and they should be non-comedogenic. If the formulation isn't gel-based, they do not generally irritate your skin. Some components like zinc oxide and titanium oxide are recommended to be avoided in individuals who have acne, as these are little large greasy molecules which could sometimes stimulate your pimple formation. And it
Right.
is recommended that you use a light moisturizer and then apply the sunscreen on top of it.
Okay, doctor. And because you also mentioned in the beginning that lifestyle modification or a healthy lifestyle, healthy diet is very important. Any lifestyle changes to be done in reducing acne or managing acne well?
A lot. First, we'll start with diet. Diet should be very healthy. By healthy, I mean you should consume little amounts frequently instead of taking heavy amounts just twice or thrice a day. Also, you should avoid dairy products. If to be specific, I would say chocolate, ice creams, pastry, milk products, milk per se, especially the packeted milk, curd, these are to be avoided. Oil, junk foods. Then in fruits, we have mangoes, watermelon, and pineapples, which are to be avoided. You should take more of green veggies, consume more of water, and you can have fruits other than the three which I have asked to consume less. But the dairy products you should strictly avoid as much as possible for people who have severe acne issues. Then the second recommendation is to have lots and lots of fluids. You should have lots of water, green tea, buttermilk, coconut water. And thirdly, you should sleep on time. Ideally, it is recommended that you should sleep before 12 p.m. The later you sleep, the more your hormones are stimulated, the more the cortisol levels rise, and the more you'll have pimples. Then also it is advised to stress less. People who tend to stress more, they have more pimples. So it's always recommended to do your stress management as well. So it is a holistic approach. You have to have your medications, but you also need to maintain your lifestyle to achieve the best results. So these things are also to be followed in case you want the best results from the treatment.
Fair enough. And doctor, before we sum up the whole session, any take-home message for our viewers?
Yes, as I already said, you should always maintain a healthy lifestyle. In case you're facing severe acne issues, do not delay to avail your treatments and make sure you're taking the treatment from a board certified dermatologist who's qualified to give you the treatment. Do not be influenced by these YouTubers and influencers and start using products. Many a times it has been seen that due to the use of various products, multiple products, also people are getting acne. And you should never lose hope, as there is always a treatment for pimple. There is a treatment for acne scars as well. You just need to consult the right person. So never lose hope. In case you're facing from severe pimple issues, severe acne issues, acne scar issues, just go to the doctor at the right time and maintain a healthy lifestyle. That is very important. In case you maintain a healthy lifestyle, you're very less likely to suffer from acne issues, mostly the adult acne. The teenage acne is somewhat hormonal, but after the 25 years of age acne, it's mostly under our control. So we should try and control our lifestyle. We should have a healthy lifestyle. We should do a lot of physical activity. Our lives have become very sedentary. So we should do a little of physical activity. Every day, 30 minutes of brisk walking, jogging, running, swimming, anything, whichever we like, whichever activity we like, which makes us really lose our breath, that kind of activity is recommended. 30 to 45 minutes of that kind of activity really helps in maintaining a healthy lifestyle. And above all, sleep on time. We should try and sleep before 12 p.m. So this is all, and I hope after seeing this video, at least you start living a healthy lifestyle, because that is very important, not only in pimples, also in a lot of skin and hair issues, that your lifestyle is maintained well.
Thank you so very much, Dr. Kirti. It was wonderful talking to you. Thank you for your valuable time and this very informative session. Thank you
Thank
so
you
much.
for having me.
And viewers, thank you for your active participation in today's session. Stay connected to our beautiful Spotless Skin page. Stay healthy, stay happy. Take care. Goodbye.